I've had to explain my risk even to my own personal providers. And when I say I have an ATM mutation, it's so hard to find someone who even knows what I'm talking about. Typically, ATM is considered a moderate penetrance variant or mutation. So a moderate risk gave me a 69% risk of breast cancer, 5 to 10% risk of pancreatic cancer, and then a 2 to 3% risk of ovarian cancer. And then if you're male, also prostate cancer risk. Had an MRI come back showing an abnormality. The radiologist that read my scans that day asked me like what an ATM mutation was, which was a red flag to me, right? Like you're managing my care, like you're making recommendations for my care moving forward, and you don't know what my mutation is. So it was very interesting. I met with 2 breast surgeons after that, and we did some more testing. They were like 99% sure, their words, that it was not cancer. I requested a biopsy, and because I was still uncomfortable with all of that, right, and like my risk, so ended up getting diagnosed 2 weeks before my preventative surgery. You do really have to advocate for yourself. And like you said, genetics has come so far in such a short period of time that there is a major lack of knowledge. And in my opinion, it really has become a barrier to patients seeking care. As patients, we can't make informed decisions if our providers aren't educating us on our options, right? And there are NCCN guidelines in place for genetic testing, but they are not being utilized.
This is Genetics for Healthcare, a podcast for patients.
Welcome to another episode of Genetics for Healthcare, a podcast dedicated to patients and their caregivers to help us understand this world of genetics and genomics and their implications for our healthcare, which includes disease screening, treatment, survivorship, and of course, prevention. You can find us at geneticsforhealthcare.com. From there, you can connect with us on social media, any of your favorite platforms, especially YouTube. While you're there, hit that subscribe button to get updates and notifications on amazing new episodes like this one. Today, I'm honored to have Krista Brown, oncology nurse navigator, breast cancer survivor, and ATM variant carrier. Going to find out a little bit more about that soon. Krista, thank you for sharing your story here on Genetics for Healthcare.
Yes, thank you for having me. I'm honored to be here, grateful for the work you're doing. So yeah, looking forward to it.
Thank you. So we met through the tremendous Kathy Baker, who is doing amazing work at My Faulty Gene. You were one of the speakers at her annual gala, which is a celebration of survivors and previvors of cancer, and just the amazing work that she's doing. So let's your Genetics for Healthcare journey began with a significant, family history of cancer. Could you share more about your mother and your grandmother's diagnosis and how that influenced your personal health awareness journey?
Yeah, so my mom was the first person in our family to actually be diagnosed with any type of cancer that we know of. It was breast cancer, and her mom, like you mentioned, was also diagnosed a few years later. But my mom was first in our family. So she was young, 48. She was healthy, stage 3 diagnosis, and it really just came as a shock to all of us. She was offered genetic testing at that time for BRCA mutations, which were the only mutations they were checking for at that time. Um, but she was negative. So went through 12 years of every kind of treatment. And a few months before she passed away, somebody luckily offered her expanded genetic testing for all the mutations that they knew of at that point linked to breast cancer. And she tested positive for an ATM mutation. So when she found out, she just sent all of her kids a text letting us know that she tested positive, that we had a 50% chance of also inheriting that mutation from her. And that was kind of the end of the conversation. And really, the first time, even as a nurse, that I had ever heard of any type of mutation other than the BRCA genes linked to cancer. So this was news to me. I had reported my family history for, at that point in time, 12 years of breast cancer. And the only question that anyone ever really asked me was, did your mom test for the BRCA mutations? To which I could confidently answer yes, right? But she was negative. So the thought that I was even like missing out on anything never even crossed my mind. So once I learned about her mutation, I decided to pursue my own genetic testing. And it was at this point a few months after she passed away, um, and found out that I was also a carrier of this pathogenic variant in my ATM gene. So our mutation is a little bit different than most ATM. Like typically, ATM is considered a moderate penetrance variant or mutation, so a moderate risk. But our variant is actually a rare pathogenic variant that gave me a 69% risk of breast cancer, 5 to 10% risk of pancreatic cancer, and then a 2 to 3% risk of ovarian cancer. And then if you're male, also prostate cancer risk. But yeah, but it was really, the whole experience was really eye opening to me, even as a healthcare professional.
The ATM variant itself, according to the NIH and other sources, you can Fox Chase, National Society of Genetic Counselors, it
Mhm.
is estimated between 1 and 2% of the population have an ATM variant that may increase the risk of the different cancers that you talk about. But what was it like when your mother was first diagnosed and then your grandmother, knowing that, whew, it's not genetic? We tested for BRCA, and then later finding out, well, we have more information. We want you to have this expanded test. What was that whole process like revisiting that all over again?
A little overwhelming for sure. And I didn't really have a clue where to begin at that point. I had never worked in oncology at that point, and so I didn't really know where to start. Um, I was 38, so I was the age where I was supposed to start mammograms based on my mom's diagnosis age,
Mhm.
10 years prior to her diagnosis. So um, I went to my OBGYN and really just requested testing. I didn't know where to go. So um, but to be honest with you, even getting to that point was a little bit stressful, right? Like I didn't who wants to know? Like you don't really want to know after you watch a family member go through something like that. And her death was very fresh. It was still it was just a couple months after she passed away. And so I did hesitate to even move forward with testing. Um, because I think if you test positive, you kind of just feel like your entire life is like laid out for you at that point,
Mm.
right? Like you have those feelings. I think everyone does, but I just got to the point where I realized, not knowing my risk doesn't really change the risk, right? And so I knew I would have more thorough and frequent screenings if I did test positive. And one day I just decided that I was not going to let cancer steal anything else from me if I had the chance to do something about it. And so I went to my appointment and asked my doctor to order testing for me.
So, okay, so I want to double click into that whole experience right there because you said something. So you said, who wants to know? And I've heard that,
Mhm.
before with people who, are healthy individuals who have this offered to them and they go like, I don't want to know that. It's just like, a cloud hanging over, that they may feel that genetic variants are deterministic, meaning that if you have a variant, you're gonna have cancer of a certain type.
Mhm.
How did you get from, that mindset of, oh my gosh, like who wants to know, to conquering that fear and that anxiety that says, I'm not going to allow cancer to take anything else from me,
Yeah.
and educated yourself and just shifted your mindset to say, hey, this is going to be helpful for me, and to actually take the expanded genetic test.
It definitely took some processing. I think for me, the biggest mindset shift happened when, I realized in learning and reading obviously lots of different things. But I the understanding that the earlier cancer is detected or caught, the better the patient outcomes are. That really shifted something for me. I don't think everyone realizes how much of a difference it makes. The earlier diagnosed, the better patients do survival wise. So, but also having 3 kids and my husband who were very familiar with cancer. Um, we had been through that with my mom recently. My husband's sister also passed away in her 30s from colon cancer. So this was something we were very familiar with, and not something that I ever wanted to put my family through again if I could help it. And so that was kind of the determining or like the deciding factor for me in like whether I was going to move forward with testing.
You mentioned that the ATM variant increases your risk. We'll have the exact percentages. I don't have them in front of me on our page at Genetics for Healthcare. But how did you, educate yourself about the increased likelihood of breast, pancreatic, ovarian cancers? and then take the actual step to say, okay, I'm going to take preventative measures to prevent a cancer diagnosis.
So I am like an overlearner. Like I learn, like I will take class after class after class. So I did take a deep dive into like researching, and the first resource that I found was Force. I'm sure you're familiar with Force, which
Mhm.
is a great source of information for the hereditary cancer community, and have a lot of good like reliable information on their page. And so that was the first resource that I found, and kind of dove into things from there. Took some continuing education courses like in cancer genomics and precision oncology, and learned a lot that way. And then also met with a genetic counselor who reviewed my results and risk management, and for each type of cancer, not just breast cancer, right? And like action steps that I could take moving forward. And so that's kind of how it started.
When you found out your risk that you tested positive for ATM, the
Mhm.
ATM variant, can you walk us through the emotional and the practical considerations once you learn you had that ATM variant about prevention? I forgot to mention at the top of the show, folks, that if you look her up on Instagram, she is the cancer prevention coach on Instagram. Great follow, by the way. But talk to us. You made a decision
Mhm.
to have preventative surgery. What was that like, and what was found?
The choice to have a preventative mastectomy is never an easy one. Choosing to remove body parts when you're not even really sure you're going to get cancer was really hard for me to wrap my head around, right? Especially after watching my mom go through. She had a really difficult experience with breast reconstruction, multiple surgeries and complications, and thinking of going through that after watching what she went through was really hard for me, especially without a diagnosis at that point, right? So but again, like what it ultimately came down to was like not wanting to put my family through what I had to watch her go through. And so I don't know. I chose to have a double mastectomy with deep flap reconstruction. And my doctor told me when I was considering options that a preventive mastectomy drops your risk from what mine was at 69% to less than 5%. And so that kind of sold me. That was a drastic reduction in risk. And so I was like, let's do this. But yeah, so scheduled my surgery. And then continued with screenings, had an MRI come back showing an abnormality. And the radiologist that read my scans that day asked me like what an ATM mutation was, which was a red flag to me, right? Like you're managing like my care, like you're making recommendations for my care moving forward, and you don't know what my mutation is. So it was very interesting. Yeah. So I requested, I met with two breast surgeons after that, and we did some more testing. They were like 99% sure, their words, that it was not cancer. I requested a biopsy, and because I was still uncomfortable with all of that, right? And like my risk. So ended up getting diagnosed 2 weeks before my preventative surgery was scheduled.
You diagnosed before the surgery.
I was, yeah.
Wow. Okay, and so when they did that, what was found in the pathology?
So originally, so this was 2 weeks before my surgery, but biopsy, they reported DCIS at that point. But 2 weeks later, my surgical pathology came back. It was stage 1A, invasive ductal carcinoma, hormone receptor positive, which is very common with ATM mutations, HER2 negative. But um, I was very lucky, right? Because my cancer, it was so early. I also did oncotype testing, which if you're not familiar with that, that's just genomic testing where they test your tumor, and my score was very low, which meant I didn't need to do chemotherapy. So I don't know, I was able to avoid chemo. I know I really dodged a bullet, knowing how differently my story could have turned out. So I don't know, I'm always going to be grateful for that.
I almost like jumped and like scoffed every time I hear Kristen. I talk to caregivers. I talk to people who are in active treatment, people who are survivors, who mention that their doctor doesn't know what this was, or they mention genetic testing to the doctor and they oh, you don't need that, right?
Mhm.
Um,
Mhm.
or they order the test and there's something there, but they don't even apply the information. They don't apply the information in the treatment
Mhm.
decisions, and that's my immediate hot button, right?
Yeah.
So, and this is obviously why we do this podcast, to
Mhm.
tell the story over and over again to people that listen. Your doctor may not know this, so we want to arm you with the knowledge, the language to go in and advocate for yourself. But okay, we've been talking to you as a former patient, someone who conquered cancer. But let us all remember you're a healthcare provider, right?
Mhm.
And you mentioned there's a big dilemma with clinicians who have just not been trained on genetics. It's not that they don't know out of defiance or just intentional neglect. This is an ever growing field, and we are doubling the amount of medical information. Genetics and genomics has a big part to do with that. But how do you think this gap
Mhm.
impacts healthcare professionals today, and like what changes would you want to advocate for in the nursing education regarding genetic literacy, not only for oncology nurse navigators, but advanced practitioners and clinicians who will treat patients who could benefit from this information?
Yeah, I love this question because there really is a huge gap, and stepping out of the nurse's role and into the shoes of the patient really opened my eyes to just how big of a gap there is, right? So, especially when we're talking about cascade testing at a primary care level, I can't even tell you how many providers I personally have had to explain my risk to. And even when I was going through treatment and or not treatment, excuse me, my like surgical process and just talking to doctors that I both work with and not in oncology. This was before oncology. I like to clarify that because they're doing great in oncology. It's like the prior to oncology, I think, where we need a lot of work. But I've had to explain my risk even to my own personal providers. And when I say I have an ATM mutation, I, it's so hard to find someone who even knows what I'm talking about, right? So you do really have to advocate for yourself. And like you said, genetics has come so far in such a short period of time that there is a major lack of knowledge. And in my opinion, it really has become a barrier to patients seeking care. So, as patients, we can't make informed decisions if our providers aren't educating us on our options, right? And there are NCCN guidelines in place for genetic testing, but they are not being utilized. So, and from a nursing perspective, I think we do have a long way to go. Knowing your personal risk changes your management, right? So, being aware and recognizing when testing should be offered to patients, but also educating on the reasons why it benefits them is it would be a huge step in the right direction. Um, but even okay, for example, overheard a conversation. I think we need to change, like, really how we're approaching genetic testing and how it can be empowering to patients because I recently heard a conversation between a nurse and a patient who was telling the nurse that she had just found out she was the carrier of a genetic mutation linked to cancer. And the nurse's response was, "Oh, no. I'm so sorry. I'm so sorry to hear that." And I'm like, "Wait, no. This is a good thing, right? Like, this is a good thing." And
Mhm.
so I think, yeah, one of the big problems is, like, from the patient perspective, right, I believe that my mom's choice to have genetic testing and share her results for me or to with me, um, was such a gift to me. And it really changed the course of my entire life for the better, right? But I think that the conversation around genetic testing and how it can change your treatment and like even just give you personalized care, right? It needs to change. And that starts with healthcare provider education.
Genetic testing saves lives. I don't know how clear this could be, and that is probably the most poignant way someone's put it. And I appreciate you for sharing that example because there is a natural inclination to say, "Oh, like, oh, that's too bad." No, we want this information to not be intimidating, but empowering to people to know that you carry that, to know what your risks are, and then make decisions based on that, informed decisions to better your care. This is why the podcast is called Genetics for Healthcare, by the way. I also want to step up just on the first step of my soapbox really quickly. Okay, so you mentioned that we're doing okay in oncology. That we may be doing good where you practice. Now, on the industry side, I've been in the industry leading strategy, leading sales teams,
Mhm.
commercial teams to get these types of tools, genetic and genomic testing, into the marketplace. And year after year, we did market research. And Krista, I'm sorry to tell you, for
Mhm.
patients who are diagnosed with cancer, if we just looked at the data that we collected, and listen, present day, we're talking about the last 5 years, we're still less than 25, 30% of patients who are diagnosed with cancer who are affected by the types of cancer where there are clear guidelines and reimbursement for genetic testing and genomic testing. The data shows they're still not getting it. Take it a step further. Even when these patients, let's say for genomic tests for lung cancer,
Mhm.
for pancreatic cancer, if you get these tests and it indicates that you might be a candidate for a targeted therapy, a
Mhm.
therapy that's on the market that is shown to improve response rates and survival, there's a certain percentage of those patients, that was around 50%, that still don't get access to the therapy for whatever reason. So there's a huge gap there, and that's why I was very interested in talking to you,
Mhm.
because as an oncology nurse navigator, how does your personal experience with being, testing positive for a high risk variant like ATM influence your care for patients, especially when discussing the genetic risk and screening protocols
Mhm.
for a patient who might be in front of you who is diagnosed with cancer, but getting them to see beyond and how important this is for their family members and future generations?
Yeah, well, it dramatically changed the way that I practice as a nurse for sure. And my experience is really what drove me into the oncology setting, in that career shift for me. But one of my favorite things in my role as an oncology nurse navigator is finding patients who qualify for genetic testing and educating them on those benefits, because I think sometimes it's offered without the education aspect, right? So like again, they're not understanding how it benefits them. And so like why would I do that, right? Like that's the overall response. So my goal is always to make sure they understand, and obviously it's always their choice to make an, as long as they're making an informed decision, I'm okay with it, but just making sure that they're educated on it. But so people are scared to test, and rightfully so, but the way that I approach it with my patients is, it's very similar. It's just data. It's very similar to like checking vitamin D levels. When we know your vitamin D levels are low, we can adjust things to get you back to where you need to be, right? So similarly with genetic testing, we have information so we can personalize your care and even your treatment if you're someone in treatment. And you're really getting just like you said, more targeted therapies personalized to you in your situation. And so, um, I don't know. I love teaching about genetic testing. I also have the ability to refer my patients for genetic counseling if that's something that they would like to do. And so, it really has just brought my personal experience full circle as someone who was never offered genetic testing myself. So, being able to offer that and then refer them has been really cool to watch. But I'm definitely, again, I'm back to the education. I think that's where we need the
Yeah, well,
most.
I hope your healthcare system actually understands how valuable you are in that clinic, because what is commonplace, what has been commonplace in the last several years, as the evidence has grown, showing the significant value of having this information, specifically for with germline genetic testing, there are now not just risk assessment, but there are treatment and clinical trial implications
Mhm,
for this information, which is important to have. But the practice has been, if a patient is diagnosed and they matriculate through the healthcare system, maybe when they get in front of a surgeon, a breast surgeon, or a treating clinician like a medical oncologist,
mhm,
a gynecologic oncologist, maybe someone will mention genetic testing and say, we're going to refer you to the genetic counselor. Well, that could be a 3 month, in some healthcare systems, 12-month wait just to meet with a genetic counselor to answer the question, what is genetic testing?
mhm,
When there's someone who is at least knowledgeable enough to explain what it is in the clinic, and take a tube and collect some saliva or some blood. Like, it can be done right there at the point of care. And that's what's not been happening. But
Mhm.
I don't know about your system, but I'm hoping that's happening more and that's a larger conversation with you and your colleagues.
Yeah, yeah, it is, and in my experience, I rotate between 15 different clinics, and
Oh,
so
wow.
it definitely varies. Some providers are better at it than other, but in general, where I work, they do pretty well, and our genetic counseling wait is not that long, which I'm very grateful for. But yeah, like you said, there are even my husband when he went to do genetic testing, I think he waited like 4 months to get in outside of my system. But
Yeah.
yeah, a lot of people are waiting a lot longer. Hmm.
Well, so I don't know if this makes you a triple, quadruple threat. You also talk about the importance of nutrition with respect to healthcare, cancer care. Again, follow her on IG. She is the cancer prevention coach on Instagram. Can you elaborate on why you emphasize nutrition so strongly, particularly for individuals with like genetic predispositions?
Yeah. Well, for me personally, in my own experience, right, genetic testing, when I found out my risk, the first question that I asked my doctor was, okay, now what do I do? What do I eat? What can I do to reduce my risk? Right. Like I'm like an action step kind of girl. Like I needed steps. And I think a lot of people do, like in that moment when you feel so helpless, like your genetics are out of your control, right? But there are other things that you can control. um, and working as a nurse in an acute care setting for so long, it was obvious to me that nutrition made a big difference in patient outcomes, but my education as a nurse didn't really include a whole lot, just basics about nutrition. And so I started digging, just took courses, reading, ended up with um, a master's degree in medical nutrition focused on cancer prevention, and really just learned so much that made me feel so empowered. um, and like how food can be such a powerful tool in our efforts to reduce our risk. And so I don't know, just something that gave me some control in that moment when I needed it the most, I think.
So I grew up, I'm from Denison, Texas, small town Texas. Um, my family, my father he worked for AT&T, but he had a pig farm, right? And
Oh,
so,
really?
yeah, yeah, listen, I tell people I'm a country boy. I grew up slopping hogs.
That's okay.
It is, right? So, and here's the thing. So, country people like are super healthy people. Like my grandparents lived into 90 years old. Like my
Hmm.
maternal grandfather and grandmother, because they believed that food was your first medicine.
Hmm.
So, okay, disclaimer: this is not medical advice show. We do not give medical advice
Right.
on websites on all the things. But I'm going to ask you, Krista, like, what are some foods like? Yeah, I'm still of that mindset. Like, put good things in your body. Hey, I like to eat barbecue and fatty foods, fried foods, like anybody else. But for the most
Yeah.
part, I'm pretty good. So, what are foods that have like cancer fighting properties that we should be aware of? Not just in the event that we're diagnosed, but that we can incorporate into our diet on a daily, weekly basis.
So there are a couple, and for me personally, like just from like somebody with a mutation that increases my risk, I like to choose foods that kind of fill in the gaps of where my genes are lacking. Right. So my AT mutation impairs my body's ability to repair DNA damage, which is where cancer kind of begins. Right. So when I'm thinking about food, I really try to focus on things that either like protect from DNA damage or support DNA damage repair processes. So I mean, there are a couple of things that I tell most people that you can implement no matter kind of where you're at in life. And like, so the three biggest tips that I give to everyone would be to first like fill your plate with whole, colorful foods. Right, the more color and variety, the better. So when I say whole foods, like I'm talking about foods that are close to their natural state. So like whole greens, nuts, seeds, um, fruits, vegetables, legumes. So as many as possible. So when it comes to meat, obviously, like processed meats are a class one carcinogen, so that's different. But in general, I think just choosing like to have limited quantity and like higher quality is generally my recommendation when it comes to meat. But processed foods tend to tip the scale in the
Mhm.
opposite direction that we want it to go. So just focusing on filling your plate with whole colorful foods can make a big difference. And each color represents different anti-cancer nutrients and compounds, and so will impact cancer development in different ways. So
Well, I want to get into that. Okay, so colorful foods like vegetables,
Mhm.
fruits. Like,
Mhm.
what do the different fruit colors represent? Right? Like, what?
Yeah. So they're like phytonutrients and flavonoids, they're called. And so those are the things when you're reading nutrition research that they're finding are impacting cancer development and those pathways that lead to cancer development. So um, and there's no perfect diet or no perfect like one food that's going to eliminate your risk of cancer. But again, just like filling with like using as many or eating as many colorful foods as possible, you're getting more of those anti-cancer nutrients and just I don't know, just I don't it's so empowering to me to think that our food can do so much.
Think colorful salads,
Yeah.
folks.
Yeah.
Right? And so you mentioned also processed meats, class one carcinogen. Can you just explain that a little bit more plainly for our audience and like what's example? Like I know like hot dogs, right? Like
Yeah.
as good as hot dogs can be at a game, right?
Right.
As my nephews call them glizzies. Like
Yeah.
I don't eat hot dogs anymore, but what are some other like
It's hard
processed
to
meats?
right, it's a hard change to make, but yeah, I think processed meats include things like bacon, deli meat.
Bacon?
Yeah,
Oh,
I know
that
that's
hurt.
a hard one for a lot of people, I
That
know.
hurt.
I know it's hard, right? But again, choosing to limit it, maybe not, have it every now and then, but, especially when it comes to colon cancer, like, that's a huge, there's a lot of research on processed meats and colon cancer.
Man,
So
listen.
something I try to avoid. I was raised in the South too, in South Carolina, so it's hard, right? That's what you were raised on.
Hey, listen, I did mention that I was, my grandfather was a pig farmer. I was saying,
Mhm.
like bacon is like as close to God's perfect food as
Yeah,
I can imagine. But point taken. I appreciate that expertise here on the podcast. So,
yeah.
Krista, we always ask our guests whether they are patient advocates or experts in the field for practical tips that our audience can take away to one, become better advocates for themselves and their genetics for healthcare journey. But given your background as an oncology nurse navigator and a nutritionalist, what are three practical tips that you would give our audience regarding genetic testing and nutrition around cancer prevention?
Okay. So, I don't know. I am a huge advocate, obviously, for genetic testing, and I think, we talked a lot about just the fear behind it, but I think understanding how empowering it can be to you, and how much it can change your care and personalize your care. I don't know. I'm like, that's my first tip. Like, just go get genetic testing. And I believe that anyone, even without a family history, like knowing what I know now, I think I would have chosen to do genetic testing if I knew back then what I know now. Um, I think it never hurts to have that information. So, a lot of people think that it's expensive, but you can get a full panel now for around $250, which, in my opinion, is totally worth it. And if that's hard price to come by, like financially, that's not accessible to a lot of people, but there are organizations that can help, like My Faulty Gene, right? That um, help provide testing for people who are not able to afford it. So I think everyone should do genetic testing. So that's one thing. Community, I think, has been a big part of just the whole thing for me. I was never somebody who would have gone to a support group or anything like that, right? But I did start my Instagram, and like the more people that I've connected with in this community, I think the more empowered I felt. And there's no one that understands what you're going through like somebody who has been there, right? No matter how much your family and friends care, it's not the same as as like getting to know people and learning from other people's experience. And so I always recommend, making sure that you're connecting with people who understand and have been there, because it makes a huge difference as you go through this whole journey. Reviver, survivor, thriver, like whatever point you're at, find your people and you know let them
Create
in.
community. Yeah.
Yeah. So and then I think the only other thing I would add, I think, would be to, I would recommend genetic counseling to everyone. I think it would have made such a big difference for me. my provider really just handed me the results and said, "You're positive. Here's some referrals I can offer you. Let me know how we can help." Right?
Yeah.
And I think in that
Yeah.
moment, I wish that I would have done genetic testing prior to testing because I was so shocked by, like, the pancreatic and ovarian cancer risk. Had no clue. I was prepared for the breast cancer part, but, um so now I recommend genetic testing or excuse me, genetic counseling to anyone preparing for testing because I think it would have made a big difference for me and a lot of people, if that would have been offered prior to testing.
Very, very, very rich information, especially around the nutritional aspect. Krista Brown, the cancer prevention coach on Instagram. Fun fact about Krista, so I love this. You collect shells from the beaches or wherever you travel with your kids and you label them and create memories. That's
Yeah,
incredible.
it's one of my favorite traditions that I've been doing personally for a long time. But my kids just like always, they loved it when they were younger. They always wanted to go through it. So I finally just bought them all their own, and it's a good way to fill our jars with memories. That's how we what we say.
Yeah, my daughter Zoe, who's the voice of Genetics for Healthcare.
Oh,
Um,
that's
yeah,
I
she's
didn't know
she's
that.
15 now, but
Okay.
she has this stuffed like bunny, and like she got it when she was 3, and his
Mhm,
name is Bun Bun.
mhm,
Bun Bun needs a passport because Bun Bun has been everywhere with her. Every time we travel, we took a trip this past weekend, and of course, who's there? I'll put it like this: Bun Bun is so old, like we had to like sew his neck like back on because like he's old and tattered, and now he's like his head rolls around. But she won't give him up, and wherever we go, she makes sure she takes a picture, travels with Bun
yeah,
Bun.
it's the memories, right? That's what it's all about.
That's right.
Love that.
That's right. Thank you so much, Krista Brown, for being a guest and sharing your genetics for healthcare journey with us.
Yes, thank you so much for having me, Rom.
This is Genetics for Healthcare, a podcast for patients.